Over the past week, coronavirus has been striped through the world, with 24 people being killed and hundreds of others infected by the death-toll disease in Wuhan, China. Although the virus has already caused alarm, one expert thinks that it will be difficult to survive in summer. The spread of coronavirus has raised concern among global health authorities who are looking at instances of snowball while the epidemic is traversing the world from the Far East. As the disease spreads, China has 14 cities in lockout with 26 fatalities and 800 reports around the country. Coronavirus has come during a difficult time for health workers, who can struggle in the cold winter to contain human-to-human transmission. Winter is the best breeding ground for viruses that are able to spread to humans because they are more secure in cold air and are less warm for a longer time. The cold frequently decreases body defense, making it easier for pathogens to enter the body. The coronavirus will fail to infect humans in the season, according to Dr. Jonas Nilsson, MD, co-founder of Praxio, a travel vaccine company. He said to express.co.uk, warm temperatures for coronavirus are not helpful. Chronic cold is typically certain forms of coronavirus infection. Cold is more prevalent during the winter, when cold nose membranes cool down, making it easier for the virus to get into the bloodstream. Dr. Nilsson has given travelers a variety of suggestions as the virus begins to spread. He warned that measures be used: avoid non-essential travel to Wuhan and China and neighboring areas, avoid direct relationships with people with acute respiratory infections. Prevent live or dead livestock, animal markets, products coming from animals, for example uncooked meat. Dr. Nilsson added, studies show that face masks will help prevent virus transmission. The number of countries which reported incidents of the virus has now risen to 10, including the USA. It is an excellent idea that face masks can be used at places where there are numerous people, such as airports, train stations, metro stations, etc. The most famous tourists in Vietnam, Thailand and Singapore are also in countries where the virus has spread. The World Health Organization, WHO, was hesitant to declare an alert for public health. The Committee on Emergencies said that while the crisis was urgent, it did not yet constitute an international disaster in the organization's International Health Regulations, 2005. The committee noted that it anticipates more foreign cases in every place as well as the planning by the international community. They applied collaboration and communication with the multi-sector, and active participation in the development of knowledge about viruses or disease should focus on reducing human infection, prevention of secondary transmission and international spread, and contribute to the international response.
China said on Saturday that it would suspend all tour groups and the sale of flight and hotel packages for its citizens headed overseas, starting on Monday. The Association for China's Travel Agencies said tour groups that were in the middle of their trips could proceed with their itineraries but should closely monitor the health of their travelers. This measure may come as welcome news to countries that have been gearing up to screen travelers from China for fevers and other signs of infection. The Beijing city government also announced on Saturday that it would suspend all inter-province buses from Sunday, effectively limiting ruling Communist Party's seat of power. Wuhan also tightened its restrictions further on Saturday with a ban on vehicle traffic in the city center, to begin at midnight. The local government said some vehicles would be exempted, including shuttle buses and trucks moving supplies. Residents responded with frustration on social media. One woman, who said she was pregnant and near her due date, asked if she was supposed to walk to her gynecologist's office. The latest deaths brought the toll in China to 42. There were also 31 new confirmed cases of the coronavirus in Guangxi, according to reports. The vast majority of the 42 confirmed deaths have been in Hubei, where the outbreak began. Among the victims was a 62-year-old ear, nose and throat specialist in Wuhan, who died on Saturday from the coronavirus, according to a state news media report. He had retired last year, and it was unclear if he had been treating patients with the disease.